Welcome to Maine Quality. I'm your host, Orion Breen, and with me today is Nikki Busmanis of 211. What is 211?
So at its most basic, 211 is a free, confidential way to connect people to services across Maine that help them stay healthy and safe and independent. So think of everything from heating assistance to rent payment assistance. It could be medication-assisted treatment and recovery resources, transportation, food pantries, all of those different types of services that help someone meet their basic needs and then some. We help people find.
So people can just call 211 on their phone and get connected with the specialist that can help answer your questions and connect them with a ton of different services.
Yeah, so we have a contact center that's based here in Maine, and it's available 24 hours a day, 7 days a week, 365 days a year. So anytime someone is ready to reach out for help for themselves or someone they know, they can either call 211 or text their zip code to 898-211. They can also go to 211maine.org. And like I said, our specialists are based here in Maine around the clock, and they're great at listening and no judgment, and they're just there to try to help people find local resources that can help.
So how did you get involved with 211?
So my background is in public health, and I worked for the state of Maine Department of Health and Human Services for years in different offices. And I was always familiar with United Way and the important work that all of the United Ways across Maine do. And so when I heard of the opening with 211 Maine, and as someone who's really passionate about access to health and human services, I jumped at the chance. So I've been with the program for a little over 4 years now.
How did 211 get started?
So 211 Maine has been a statewide program since 2006, and it really started to gain traction here in Maine in terms of disaster preparedness and response. So in other states, they had seen that 211's played a really great role to help get information out to the public quickly and efficiently during a crisis situation. And so that's really where we came into play in Maine. And then through the support of especially the United Way of Greater Portland, we were able to work with different partners, including the state of Maine and the Opportunity Alliance, to develop this statewide program.
How can people get involved?
So there are many ways to be involved with 211. Honestly, the biggest way is to help raise awareness of it. I don't think any of us expect to be in a situation where we'll need an extra level of support outside of our natural support system. But you never know when you may need it or when a family member or friend. I've used 211 both professionally as well as personally, never thinking I would need any of the services that we include. So I think it's really helpful to get the word out about the program and in a non-stigmatizing way. Here in Maine, we're very proud people. We like to do things on our own. And so it can be really hard to ask for help. And so that's why we try to get the word out there that getting help is a sign of strength and that we all need help at some point. And so, again, whether it's for yourself or someone we're here. It's totally confidential and free. And the specialists are just fantastic at listening and really in a non-judgmental way, helping people find those resources. So first off, raise awareness, just talk about the program. Second, if you're a provider of one of these types of programs, list with us. We maintain the statewide directory of over 8,000 different programs across Maine, across the spectrum of health and human services. And so we want to make sure that all of those fantastic community-based services are in the directory. So reach out to us so we can list your amazing service and help people find you. And if you're already listed, check to make sure that your information is accurate. We have a team of fantastic resource coordinators. Their sole purpose is to update those listings, but it's always helpful to have providers initiate that outreach and say, we actually changed hours or added a new service. We saw this especially relevant during the pandemic because so many providers very quickly had to transition to providing telehealth services or decreasing their hours, what have you. And so we needed to be able to quickly update that information in the directory. So list with us if you're a provider, update your information if you're already in there, and continue to support your local United Way. In Maine, 211 is an initiative of United Way, and there are 9 active United Ways in Maine. And actually, the United Way of Greater Portland holds a really special place with 211 in terms of its leadership on the board of directors, as well as a founding member. By supporting the local United Ways, we're able to keep this program as local as possible. So 211 is a national model. About 96% of the country is covered by a 211 system. We all operate completely independently, but many other 211s actually outsource their after hours or weekends. But here in Maine, because of the leadership of the United Ways of Maine and the partnership with the state, we can keep this around the clock here in Maine 24/7.
In this past year, have you gotten more calls than in previous years?
Since the pandemic started, our call volume has tripled. So in 2019, we had answered about 45,000 calls in the entire year. And in 2020, in large part since the pandemic, we answered over 97,000 calls. 211, we're that place where people go when they don't know where else to go. So that's 97,000 times that, there was a caller out there that wasn't sure where to turn. And so we're seeing a lot, certainly an increase in calls in general. We're getting calls from a lot of folks who haven't called before because they had those natural supports in place, but because of this unprecedented situation have needed to reach out for help for the first time. So it's been really eye-opening to be able to provide that level of support.
Why do you live in Maine? What makes Maine special to you?
So I have to admit, and I feel like this is a relationship of trust right now. I am not from Maine originally. I am from Massachusetts. I've lived in Maine since about 2000, and I've left and I came back, and I left and came back, and I would not want to live anywhere else. This is the people, the culture. You're asking me in winter, so that's a little hard one seasonally, but there's just something warm, maybe not about the temperature, but about the people here that you just don't find anywhere else. I wouldn't want to raise my family anywhere else. I wouldn't want to work anywhere else. I wouldn't want to go hiking and swimming and to the beach anywhere. So I feel really lucky to live here.
Who inspires you in Maine and beyond?
Oh, goodness. I feel like this pandemic has really shown a light on a lot of roles that historically haven't gotten a really bright light shown on them before. So, certainly all of the healthcare providers going out there and even when most of the state was shut down, continuing to work and provide important and literally life-saving services. All the way to, the folks at Hannaford. I was able to fortunately work remotely, have my kids home with me. We were able to make it work during the lockdown, but a lot of those folks, they still every day had to go into work and stock shelves or help people find needed food to be able to survive. So I feel like all of those essential roles, and certainly teachers, I am so appreciative of the work they do day in and day out for our kids. And if I didn't have quality childcare and schools for my kids to go to, I wouldn't be able to be here and do the work I do. So all of those, the unsung heroes, I guess, they're the ones that really inspire me.
What do you think are Maine's biggest challenges or opportunities? I
think that the lack of public transportation across the state is a significant challenge. I know at 211, one of the reasons we don't ask a lot of, demographic questions or collect any of that information on initial calls with folks because we want to be as low barrier service as possible. We want to get people the information they need quickly so that they can start reaching out to different programs. But one of the questions we do ask is for their zip code or the zip code where they're looking for a service. And that's in large part because we know transportation can be a barrier for many people in Maine. So by providing a more local option, we're increasing the likelihood that they'll be able to actually access that service. And so I think not having more reliable or robust public transportation options, especially in rural parts of the state, is a challenge, but I also think it can be a significant opportunity for us.
So the legislature has declared February 211 month. Congratulations. Is there anything we haven't talked about that you'd like to say a few words on?
In addition to helping people find needed health and human services, we also provide some specific initiatives and relationships across the state. So we serve as the state's opiate helpline, helping anyone looking for an opiate-related service for themselves or someone they know find local options near them. And we'll also offer those callers a follow-up, just to, totally optional, but to make sure that they were able to access services and provide alternatives if not. We serve as the state's gambling helpline, helping those looking for problem gambling resources, again, for themselves or someone they know. We're involved in the United Ways of Maine's Keep Me Warm Fund, which provides emergency heating assistance. We help those across the state get connected to programs and services like tax preparation through the Cash Maine and the Cash Greater Portland initiatives, which are, totally safe and easy and great to use. Right now, we're answering frequently asked questions for the public regarding COVID-19. When we first started those conversations with the state back in February of last year, we were anticipating, maybe 80 calls a week with questions. And the second week we had over 2,000. So we knew that there were a lot of individuals across Maine with questions from everything to, what is COVID-19? How can I prevent it? To, can I travel to Massachusetts? Can I go to the store? Now we're getting a lot of questions about texting and the vaccination distribution. So it's important for us to just be there, within our scope of services around providing information referrals to the public. How can we make it as easy as possible for people to find the information and services they need?
You're listening to Maine Quality. I'm your host, Orion Breen, and with me today is Nikki of 211. Thank you so much for coming on.
Thank you.